Hello, I'm Paul Barr, Senior Writer for Hospitals and Health Networks magazine. The Cleveland Clinic spin-off Explorys uses the growing pool of healthcare information known as big data to try to assist hospitals and systems with the implementation of value-based care models. I'm talking today with Dr. Anil Jain, Senior Vice President and Chief Medical Information Officer for Explorys, about the challenges and possibilities offered by big data. Thank you for being with us today.
Thank you.
For those people that aren't familiar with big data, can you describe what it is in the healthcare context?
Big data means is essentially data that is so significant in both volume and velocity, and with significant variety that the typical traditional tools used to analyze the data become less meaningful. For example, the high velocity and variety of data that comes in from medical devices, from electronic health records, from all this claims data that's coming in from the administrative data sets, coupled with the high volume of clinical activity, ICU telemetry monitoring, etc., create a huge problem, if you will, that traditional databases have been challenged with solving. So some of the big data strategies involve not just the data, but the tools used to analyze that data that is typically not amenable to traditional tools. And in healthcare, it's increasingly important for three reasons. First, because of the Affordable Care Act, we have new models of reimbursement happening that require data to be analyzed. The second, with the high-tech bill, we have more and more electronic health records, both in the ambulatory setting and in the hospitals, creating a significant amount of electronic data. And the third is the smart devices and the advance of personalized medicine, where everything that we do is generating data that needs to be analyzed in order to perform and make the right decisions in a value-based care setting.
So is it in use right now? Are people using big data to do things with their operations?
I think there's a combination of folks who are, I would say, using big data in a early stage experimental way, where they're learning about how big data can solve some of their challenges. But the vast majority of healthcare can be benefited by by leveraging small data and doing so in a way that's fundamentally more efficient. And the big data tools allow you not only to analyze the small data and make decisions, but prepare you for the future where big data will be much more important. But most healthcare systems today are working with getting their skills up to speed, partnering with the right folks to leverage the small data. And then as they mature, as they get into more and more complicated models, they are able to take those same tools and migrate towards the big data, the unstructured data, the genomic data, the high volume of imaging data that might be required to take that analytic to the next level.
So when I hear big data, to me that implies you're going to need big computers. How is this going to apply to smaller systems and hospitals that maybe don't have access to that in their own operation?
Just as you would not get a large horse to pull a cart, you'd get two horses to pull a cart. A lot of the big data strategies, especially those strategies employed by Explorys, for example, use the paradigm that sometimes a bigger computer is not better, but that more computers working in parallel are better. What we do, and I think what a lot of companies are going to do to allow a healthcare system, big and small, to leverage big data strategies is to create a cloud-based strategy that allows healthcare systems to get a slice of the parallel computing power that a cloud-based strategy might have. Rather than the healthcare system getting into the business of being a data center or getting into the business of being a data management company, they would leverage partners to allow, for example, Explorys has 2,000 processors plus in a data center that allow parallel computing and parallel storage to occur in a very fundamentally rapid fashion. And healthcare systems that are our current partners, of the 200 hospitals plus, are able to leverage that almost supercomputing strength in the kind of analytics that we provide. So the small hospital, unless they really want to get into the data management business and the data center business, is going to have to leverage partners that are providing that structure. Large hospital systems are going to have to find whether that is a business model they want to be in, or partner with those that can allow them to extend that business model to the smaller entities.
Can you give some concrete examples of how patients are affected by big data?
Absolutely. One of the biggest challenges that clinicians face today is the ability to absorb all that information and data that comes at them, either from the electronic health record or coming at them from the payers, and to be able to assimilate all that and make the decision that's best for the patient. We obviously have alerts that come and pop up in electronic health records. We have evidence-based guidelines, but to be able to take all that data and information and crunch it to the point where we can give a specific prescriptive analytic to a provider is critically important. Let's take heart failure, for example. There are models that we can apply today, like our company is doing, where we can predict the chances that a patient will be readmitted to the hospital based on the data we know, the information that we know at the time that they're being discharged. And then allow a caregiver to intervene and prevent that patient from being readmitted. Another example would be in how we prevent hospital complications from occurring, such as blood clots or wound infections, or patients who end up getting infections of their central venous catheters or their urinary bladder catheters. With big data, and by taking in their clinical data, their administrative data, and perhaps some very personalized data about their profile, and doing so in a way that still respects the patient's privacy, we can look for patterns that are going to increase that patient's risk of infection, and then intervene appropriately with either removing that catheter or device, or by instituting the appropriate antibiotic therapy. We could go through every single patient that's on the floor or on the hospital floor, or we can identify those patients who need immediate attention. And big data is all about creating laser-focused analytics when you have these hundreds and thousands of data points coming at you. And most clinicians today are having to juggle a lot of information. And what big data and big data analytics does is lets them focus on the patient-doctor relationship and focus on those things that are really going to make a difference, such as preventing complications in the hospital and preventing them from being readmitted. It's in the patient's best interest and it's in the provider's best interest.
Thank you for speaking with us today.
Well, thank you for the time.
This is Paul Barr with Hospitals and Health Networks magazine. Thank you for watching.